Okay, so for this question, we have a 28-year-old woman who presents with fatigue, migratory arthralgias, photosensitive erythematous rash across her cheeks and nose, and painless oral ulcers. Urinalysis shows 2+ protein and RBC cast. Labs reveal hemolytic anemia, positive ANA, low complement, and markedly elevated anti-double-stranded DNA antibody titers. Which of the following statements is most accurate about this patient's serology? Okay, so when it comes to finding the answer for the question, at least or the disease involved here, this is kind of a gimme, right? So you've seen the arthralgias, you've seen the photosensitive erythematous rash across the cheeks and nose, so that's a malar rash, right? So this right here would be a malar rash. Okay, now that should more or less just give you the thing. I mean, you have positive ANA and double-stranded DNA, anti-double-stranded DNA antibodies, right? So this is lupus, so SLE. Okay, so again, remember that's the anti-double-stranded DNA is specific for lupus. That's an anti-Smith. Okay, so you need to see those. So don't only look for the ANA, the positive ANA. All right, the 2+ protein and RBC cast. So that's from lupus nephritis. All right, and that's when you've got the anti-double-stranded DNA is to form some sort of complex, so like the type 3 hypersensitivities, and yes, we're going to make a video about this at some point, right? So that will then go and form complexes in the glomeruli. This is going to activate complement, so that also explains the decrease in C3 and C4, so it's being consumed when you activate complement. All right, so the answer to this would be B. Right, so you have your anti-double-stranded DNA antibodies that correlate to activity and are associated with immune complex mediated renal disease. Right, so anti-double-stranded. So let's look at the other options. Anti-Smith antibodies, best indicator. So anti-Smith, this for option A, right? Anti-Smith is going to be what you're going to see in SLE, right? But it does not correlate directly with the severity of disease or like an acute phase of the disease. That's the anti-double-stranded DNA. Okay, for option C, anti-histone antibodies, specific for idiopathic systemic lupus erythematosus. So anti-histone is specific for drug-induced lupus. All right, so not the idiopathic kind. So anti-histone. Let's just write that out here. Specific for drug-induced. Okay, I remember that's there are a bunch of drugs that can do that, but the three that I usually want to know will be hydralazine, right? Isoniazid, procainamide. Now you have some there like methyldopa and other things, but these are the three you want to know: hydralazine, isoniazid, and procainamide. All right. Then for D, anti-centromere antibodies are commonly found in SLE and predicts pulmonary fibrosis. Okay. Anti-centromere, just remember CREST syndrome. Okay, so it's called something else now, but I still like to remember it as CREST syndrome. All right, so CREST syndrome. All right, so that's where you're going to find anti-centromere antibodies. And remember that, okay, just a brief review. Okay, we're probably going to have another video on this, but the C will be for calcinosis. Let me just change the colors here a bit. So calcinosis. So you're going to end up with calcium deposits on the skin, right, and in certain tissues. Then the R is for Raynaud's phenomenon. So Raynaud's phenomenon. And that's where you have the fingers and toes kind of turn bluish, particularly when it gets cold because of that vasoconstriction. Right? The E is going to be for esophageal dysfunction, so most likely dysphagia. So esophageal dysfunction. So basically they're going to have difficulty swallowing. All right. The S is for sclerodactyly. So let's put that over here. So sclerodactyly. All right. Now this is when you have that thickening of like the skin on the fingers and the toes, so it kind of looks like a claw. Again, if you have the fibrosis of the skin, it's going to sort of contract the skin in a way and makes the fingers look like a claw. Eventually, if it's not managed, or even if it's managed well and it stays for a while, right? Then the T is for telangiectasia. So telangiectasia. Right, so this will be the spider veins that you can see on like the face, the hands, the chest, that kind of thing. Okay, then for E, positive rheumatoid factor. Symptoms that is due to rheumatoid arthritis rather than lupus. No, you see, rheumatoid factor is going to be positive in a bunch of things. Right, so even if you want to diagnose rheumatoid arthritis, you're going to go with the anti-CCP as being specific for rheumatoid arthritis, because RF is pretty common. All right, so yes, see you in the next one.